Welcome back and welcome now to our Health Wednesdays, proudly in partnership, in partnership with
Yeah.
Addy Memorial, proudly at that, Addy Memorial Hospital, which is found in Kanyanya. And today we have Dr. Colin back, Karaiga. We are going to be talking about before walking down the aisle or before saying I do, because we are entering the Valentine's, the love month. Proposals, Dr. Colin, are happening left, right, and center. The whole city is painted red. So now we need to know what are some of the tests before we are madly and helplessly in love. What are some of the tests we should be considering, and what will those tests mean? And what if does love conquer all? Those are things that we want to be able to discuss. Good morning, Dr. Colin, and welcome to the show.
Good morning, Stella. It's a pleasure to come here as always. This is a very interesting topic, and it is pertinent because, as we were discussing before, the Ministry of Health has now made it mandatory for people to have a sickling test
Yes.
for every child. So then you have to have a background of why this is. Now, any married person will tell you that it is a partnership, and that what you get after the butterflies are all gone, the reality then sets in, and then you have to deal with certain realities. Now, on the medical side of things, we usually advise that before you even make the decision to propose, there are certain things you need to find out. You need to come in for a medical. And when you come in for that medical and you make your intentions known to us, maybe your prospect for marriage, there are certain things we do. Number one, we will take a history.
Okay.
We will ask you, in your family, are there certain diseases that you know? Is there diabetes? Is there hypertension? Is there asthma? Have you had relatives who have had sickle cell? How close are they to you? So that history alone gives you the chance to make, and all of this, what we are doing, the aim of the medical interventions is to help you make informed decisions.
Decisions, yes.
Not decisions made from the heart. They need to be made from a higher organ. So now, we'll take the history and just help you find out that background, because you will find out things, and you can find out later that maybe this has been running in the family, or even things like albinism and things like that. So if you both have it on your side, then you make the decision knowing that there's a chance that we could have this. So after that, then we now do testing, of course, which is the most important thing.
Hold on. I like where you've started from, having conversations on what are the most important cases to share with your partner on what you have in your family history. Are there things, for example, if I have a parent or a sibling who has bipolar, do I report that? What are some of the issues or medical cases that we should never leave out?
Now, without being controversial, when you're married, you're going to find out these things anyway. And someone will be very, very annoyed or feel like you hid something from them. There are cases which are hereditary, and you can just do a little bit of research. Before you go as a couple, go as a person. Find out if you're healthy.
Okay.
Ask these questions. You can ask the doctor, we have these conditions in the family. Is this something my partner would want to know?
Okay.
And the doctor will advise you. Say, yes, this is something which can be passed on. And if it can be passed on to your children, if you yourself are at risk, because there are certain diseases which you are at risk, and your partner needs to know that I'm at risk. Like bad diseases, I'll give you an example, like a certain disease called Huntington's. They are very, very, they run in families. So your partner needs to make the informed decision. And more than anything, what you need to know is that people, they will trust you more when you've revealed certain things, and you've allowed them to make that decision. So because these decisions have financial, psychosocial, mental implications on not just you as an individual, but on a marriage.
Yes.
Yeah. So if there is something that runs that you're worried about, that you could get, that you could pass on to your children, just have that medical conversation with your
With your doctor first.
Yeah,
okay.
with your doctor first. Because there's also, my father likes saying that you shouldn't assume there is a lion in every bush. You should also, like we have to understand that there are things which you shouldn't panic about, and then you go saying, because it can come out, hey, you say something like, I have a bipolar sister or something, and the person doesn't understand it. If you also don't understand that this is not
and
something,
runs with it, ho!
be like, eh, bali balalu, and
Yeah.
so someone needs to understand those things. And many of these conditions also, they are manageable medically. So they need to understand that this, if it happens, it is manageable. And then they can make an informed decision about it.
Okay, so let's get to the tests now.
So
what are the tests to do?
Yeah, like any other medical interaction, you start with history. We take the history like we've talked about, things we ask for. And the history, we said, starts with you yourself, asking around about yourself. Then you can go and ask as a couple. Then now we do certain tests. And I'm going to share some of the tests we do and the reasons. Let's group the tests into tests for infectious and non-infectious diseases.
Okay.
Infectious diseases are diseases you pass on because it is a microorganism you got in some way, shape or form. So, for example, the infectious tests, we have to do the obvious ones, I think. HIV. HIV is obvious. Hepatitis is obvious. Hepatitis B, hepatitis C, these are viruses which are similar to HIV and passed on in the very same ways as HIV. Yes, actually, in Uganda, when you're diagnosed with hepatitis B or HIV, they have to test for the other. So because they usually come in tandem and they are transmitted in the same manner. So there is that. Then, so we've talked about HIV, we've talked about hepatitis B, we've talked about hepatitis C. It is also very important to test for syphilis. Yeah, because syphilis is a disease that can be in your body for over 30 years. And it also...
In Uganda, how do they call it?
Syphilis. Syphilis, I think it is called I think it's the one called kabotongo.
That's the word I was looking for. Growing up, I used to hear people say that word, but it just, okay.
So, syphilis is kabotongo. So, syphilis can be passed on from a mother to her baby intrauterine when the baby is in the womb.
Yeah.
So, those are things you want to find out.
Okay.
So, those are the infectious ones that you need to
And
know.
of those that you've mentioned, is there any that can be treated?
All of them can be treated and cured.
Yeah.
Yeah, syphilis can be treated and cured.
Okay.
Hepatitis B, for most people, when they get infected, 78% of the people, your body overcomes the infection naturally. The other people, you go on the same medicines as you would for HIV. So these are things you need to actually test for. Yeah.
Okay, now we'll go on to...
So now, the non-infectious diseases that we'll talk about are like what the Ministry of Health is advising. You have blood disorders, which are passed on, which are hereditary. And these include sickle cell anemia.
Okay.
These include things like there's what they call a beta thalassemias. They are all similar. These include hemophilia. So these are conditions which are passed on when parents who both carry the gene for it come together. You have like a 50 or 50% chance of having a child, having them.
Who has the same.
Who has the same. And people think it is, when you're in love, you might just think, oh, we will conquer all.
Yes.
But if you've seen someone who is in the people who are sickle cell anemia, they go through what they call crises. That's how it manifests. And these crises, one of them is like a pain crisis. You can have a respiratory crisis. There are many crises. But if you've seen a child go through a pain crisis, it is so bad.
Yeah.
Their bones pain, pain in the bones. Some of them even get addicted to high-level drugs, morphine. It is a very bad disease. It takes a toll on the child.
Yeah.
It takes a toll on the parents. Then it takes a toll on the marriage. It takes a toll on your finances. So this is not something you want to take lightly. So, for example, if you find out you're a carrier, then you do not want to marry another carrier.
Yeah.
So, and these are some of the things. We advise you. We give you that information. We do not make that the final decision is yours.
I wanted to ask, because
one of the other important things which I also need to mention here is that one of the other things which we do is we test for blood groups. So now, I think you've heard people saying, "Oh, me, I'm O positive. Me, I'm B positive. Me, I'm A negative."
Yeah.
What does it mean? There's what they call a rhesus factor. It's what determines positive or negative. So, if, for example, the lady is O negative and the man is O positive, when they have their first child, the child is, because of the way genes work, and the child is likely to be positive, and yet the mother is negative. So the mother's body will see the child's blood cells as something they need to attack, because it's not similar to us. It's
so,
it's
a real thing.
Something of the sort. Yeah. So that is because we call it rhesus incompatibility. But when we know about it, then there is medicine for it. But if you don't know about it and you just continue, you have multiple miscarriages. You have all sorts of things. It disturbs. Yet, if we know about it, then we give you something called anti-D at a certain time in your pregnancy, and your body, you're able to carry the pregnancy.
Wow.
So these are things which need to be known, you know, that I am O negative. Also, if you're like O negative, which is a very rare blood type, actually, I think they have a WhatsApp group in Uganda. It's a very rare blood type. Then if in case of anything, a medical emergency which requires that blood transfusion is one of the interventions that we have to do, we have to know. The family, you'll find in the family there's another O negative person, but we have to know it, so that things are quick. When things are quick in medicine, decisions can be made and lives can be saved. So there is that. So there are many things we test for. But those are the major ones. Those are the major ones.
Okay.
We want to just find out where and give you the all clear. And then we allow you to make your decision in an informed manner.
Let's talk about diabetes and hypertension, because we see that a lot within our older parents and guardians. What has that got to do? What effect do the two have on a relationship? Are they hereditary? And then if you find a person who has that same history in their home, how would that affect the both of you?
Yeah, so hypertension, like 90% of hypertension is what they call essential hypertension, meaning that we don't know the real actual cause. However, we do know that it has a familial history.
Okay.
So if you have a familial background of hypertension, then we know that, for example, if first-degree relatives, if both your mother and father have it, there's a likelihood that you might develop it later in life, especially if you don't live the right lifestyle. And the same goes for diabetes, in particular type 2 diabetes, which happens in adults. You will find that it has there's a familial tendency to it. Yeah, it is hereditary actually. So now, when you know these things, for example, hypertension and diabetes, a lot of the factors which make them either come or come in a very severe manner are lifestyle issues. So you build your lifestyle in a healthy manner. You make sure you're exercising, you're eating the right thing, you keep your weight in check. From the go. You understand, and then you move on like that. But it also prepares you, for example, if the lady gets pregnant and there's a history of diabetes or a history of hypertension in her family and she gets it, then you know that there's this history, and let's deal with it in this manner. That's why the history is very, very important. Those are the things we elicit, that information.
Yeah.
We want to find out about that. By the way, one of the other things which many couples want to find out from the get-go is fertility.
Okay. That
Yes.
can be tested. Eh?
Yes. So there's something we do for the ladies. There are tests we do. We do an HSG. And then for the men, we can also do a sperm analysis.
Okay.
So from the get-go, you know that fine, we are firing on all cylinders, we can have a baby, or we may not be able to. So that's another thing. It's not one of the things which we say are so essential, because there are many ways of having children, but it's something which many couples want to know.
Yeah.
They'll want to know. They'll come, and which we can do for you.
Now, the people with, let's say, medical history that is not so, how should I put it? Say someone has had a miscarriage or an abortion before.
Yeah.
Is there a way for someone finding that out? Because it's so personal, someone could decide to hold it back. So is there a way to find that out? When I posted, someone is the one who asked me. Yeah.
So now, there is no, unless there has been a complication with the procedure. For example, if you had a miscarriage and then you had to have what we call post-abortal care. In medicine, any loss of pregnancy before it is viable, meaning about 24, 28 weeks, we call it an abortion. So if you've undergone post-abortal care, there is no real way of someone like your partner really finding out. Yeah. Except this is some of the information that you might need to reveal. Because we all know these procedures might come with some complications.
Yeah.
Also, if you had, for example, a miscarriage, what caused the miscarriage? You might be one of those. It might have been resource incompatibility.
Yeah.
It could be a hidden STI or sexually transmitted disease that we do not know.
Yeah.
So there could be many reasons. So it's one of those things where you choose and you're open to your partner. You say, this has happened before.
Okay, and the reason for it.
And the reason for it is this, because you want to start on a clean slate. You don't want people finding out things before, because it will come up. Say, for example, you have a miscarriage, and then after that you're having trouble conceiving. One of the questions we ask people who are having trouble conceiving is, before you met her, do you have any child? Okay. And then we ask the lady, before you met him, had you ever been pregnant? Before. So now, imagine trying to have that conversation, because
you're already deep in.
You're deep in. You need to give the medical professional enough knowledge, enough information to be able to intervene positively on your side.
Yeah.
But then there is this secret that you've been hiding. So now it becomes a bit troubling. Eh?
Yeah.
So no one will find out, but it is something that it would be nice to be honest with.
Okay.
Yeah.
So in your own work with the medical and the people you've dealt with, what do you think are some of the misconceptions that we usually have about these premarital tests, and how can we be able to address them? I feel like fear is at the center of it all.
There's fear, there is stigma, there's fear and of course stigma. There's that thing of, okay, fine, I've been well, I'm 25, 26 years.
All my life.
All my life I've not had anything. Now what if they find something?
Yes.
You understand? Also, we have to admit that many times, by the time people start going for these tests, there's a level they've gone in the relationship. They're emotionally and many times physically intimate.
Yes.
So it complicates things. If we find something, now what? Now what do we do? So that's the fear which comes. But then again, like the Bible says, know the truth and it will set you free. You want to find out earlier.
Yeah.
And find out, because many of these things we can intervene. Something can be done. and then we move on and we see. Let me tell you, if you've seen someone who is suffering from a blood disorder, it is something you as a parent you would not wish on anyone's child or on your own child.
On your own.
Yeah.
So what's blood disorder? Is
Like
that
sickle
the
cells, like hemophilia, like the beta thalassaemias. If you've seen the pain they really go through, and the fact that they live life almost always in a hospital, it's usually a short life.
Yeah.
Some people live maybe beyond 30, but it's rare in the severe cases. So you want to find out these things earlier. Then we make the informed decision and we see what are the parties. So the fear and the stigma is one of the things the big ones which cause people to.
Yeah, because it's like checking someone's phone. We've heard about that, and the warning always is, before you do, make sure you are ready for whatever comes out, because once you check and you find out, now you can no longer hide away from whatever the truth is right there in your face.
But then also I think just to your point, is there any more openness than there is in a marriage? Because the person is going to find out.
Yeah, in one way or
one way or another. First of all, for pregnancy, all these things we are talking about, the tests. When you look on a standard antenatal card in Uganda, first visit, they do all of them. Your blood group, your syphilis status, your HIV status, for every pregnancy, they'll check them either way.
Yeah.
So the one way which is maybe not regularly done is the sickling test, but they will check them either way.
Yeah.
So you're better off getting that out and you say, okay, fine, we're starting from this clean slate.
Yeah.
And let's move from there. Yeah, so.
Are there cases where you have had people who choose to go ahead and then probably things did not work out well, like their worst fears came to happen?
Yeah, they are. There are people like that. Even medical professionals, I won't lie to you, who maybe know I'm a carrier and she's a carrier.
Yeah.
And
but there's advanced medicine. We shall figure it out.
We have faith and all that. And you get poor outcomes. There are also other people I can tell you who have found out, for example, maybe the man or the lady is HIV positive and the other one is HIV negative, and they still go ahead and get married.
Alex, my co-host here, was telling us that they came for, there was this couple before they got married, they came for some marriage counseling, and then, so they reported one is positive, and then the pastors were against it, but these ones were too in love, and unfortunately right now they are both positive. But are there ways for the two to live together?
Yeah.
And one does not get to be infected? Because I know there's been advance in medication, especially for mother to child, but I don't know about partners.
Well, the advances in medicine are such that if you have HIV or AIDS and you've been started on a regimen for antiretroviral treatment, if it is an effective regimen, then your viral load can reduce to such a low level, maybe even zero, that you're unable to transmit.
Right.
Although, of course, you always run that risk.
Yes.
You always run that risk that something can happen and it's transmitted. And there are always ways, it happens, what we know. But I mean, we know discordant couples there and who are living together and who have been together for decades and they are discordant.
Okay.
So yeah, but it also maintaining that status of that, maintaining all of us being healthy being given the person who is positive is not getting sick, the person who is negative is also staying negative, and it comes from knowing, and then having interventions made, and being honest with each other.
So please, as much as possible, be honest as I don't know about as early as possible, because sometimes you're into this person and once you tell them before they are emotionally attached, then they run. Yet when you tell them and they're emotionally there, they'll stand with you through it all. So I don't know about timing, but it should
Yeah,
be
but
shared.
now, I think when planning for a lifetime, emotions are a thing which maybe we should first put on the side. First, think about the life which you want to live. Then you can now bring in the emotional aspect, because I've also seen it where people, maybe I've seen couples where, for example, they are discordant, and then in the room when they are in the consultation room with you, they are comforting each other. I'll be there for you. I understand this. 3 hours later, this guy is like, "Are you sure? Do the DNA PCR. Come on, there are all sorts of things. We don't want to go through those scenarios.
Yeah.
I think there are certain, and I think the church and other religious institutions have an important role to play here in counseling the youth and the single people about certain important conversations we should have.
We shall be having that here on the 21st.
Have certain important conversations, and the medical conversation should be among them.
Yeah.
Also, just think of the Gen Zs, the people who have been born after the year 2000. From 2000, someone who was born in the year 2000 is now 26 years of age this year.
Yeah, crazy.
26 years, and that's around the time when advances in antiretroviral medicine started. So those ones who were born with maybe HIV at that time, they are now at a point where they are going to get married.
Yes.
Where they can consider getting married.
Yes.
So you imagine if they are not properly talked to, or you imagine you're the other partner, and you're finding you've now emotionally invested.
Yeah.
And let's be honest, in a lot of society, when we are emotionally invested, people become physically intimate. So you've done that, and then now when you go for the test, you find out this person is positive.
Yeah.
Ask, when did you know? He said, maybe I was born with it. So there are those conversations which are important. Health, finances, how you're going to handle, what is your view on religion and spirituality? Are you aligned in some of those things? Because those are the things which will cause you to have problems.
Yeah. Now, before we were talking about, and let me say this, what I like about this conversation is that it's a reminder that HIV is not the worst out there. I don't know how to put it. It is bad, but usually we focus on that and we forget these other things that you're talking about. So we only focus on, as long as before we get involved, let's go for the HIV test. And we forget some STIs. Then we forget the blood things you are talking about. So I'm glad that this conversation gets to remind us that, you know what, there is so much more to this thing that we need to consider, especially before we make such a heavy commitment. But before we got on to, we were talking about something, genotype. Would you want to tell the person who is watching us more about that and how that can affect our future commitments, if at all there is a disconnect in that regard?
Genotype. Okay, genotype is a technical term that describes how can I put it? The composition of your DNA. Yeah. What I am dark, and this darkness. Okay, genotype is like the software of your body. That's the way I can say. Okay. Then phenotype is like the hardware. So the software determines what you look like, you understand, or how the operating system will be. So that's what the genotype is. It's like it tells us maybe genotype, are you a carrier for sickle cell? Do you have it in the family? Is it there? Is it not there? It will tell us about these other hereditary disorders. So that's what genotype is. It's a general term for that. Okay. But then we have to now come back and be quite specific about certain things. What is your genotype with regards to sickle cell? What is your genotype with regards to your blood group? What is your genotype with regards to a number of issues? So it's a general term. Okay. But it describes the software of your body.
The other thing that I read about when I was making research, something about AS/AS. Is that something?
That is a technical term to mean someone is a sickle cell, is a carrier for the sickle cell trait. Yeah. So those are technical terms now, you see, like reading about it. You read about it. If I gave you the results and said AS, these are your results.
Yeah.
Your AS. It is confusing. Eh?
Yeah.
So that's why I say you need to have that visit with a doctor and that conversation. And
so that they can break down
they break down everything for you. They say, now this AS, your AA, you maybe your SC. So it means that in every pregnancy, these are the chances of you having a carrier, another AS. These are the chances of you having an SS, who is a person with sickle cell, the sickle cell disease. The chances of you having a totally normal child. So all those things are explained to you. Now it is better we explain them to you before the child is there.
Yeah. Yeah, because yesterday in the paper they were talking about how most children, like 20,000 of them, do not get to even the age of 5, and yet throughout all those years the parent has been in and out of hospital and the bills are high. So that's a big one. Let's talk a little bit about, we mentioned it, for example, bipolar. There's another condition that is
schizophrenia.
Which one is that?
Schizophrenia, bipolar affective disorder, those are psychiatric disorders. Yes.
And then I want to talk about those ones, and then dementia as well.
Oh.
Yeah.
Dementia, Alzheimer's, those come later.
That come later. And whether or not they can be discovered early. I have a friend right now, because when I put it out there, when I posted that we're going to have this conversation, my friend was telling me that, you know what, right now we are treating my mom of, because I think it is Alzheimer's, but for me, when he told me, I'm like, dementia? It's like, no, there's that other term, so we never got to it. But it's like, my dad, I don't think my dad knew that this could be something that comes up.
Yeah.
So let's first discuss, first of all, the bipolar and that one, and then also the dementia and Alzheimer's. How do we go about it, even if those are things that come maybe much later on?
Now, that's the importance of visiting with a doctor, because we'll take that history. Part of the history, if you look at, we take your past medical history, which tells us about chronic diseases you might have had. We take what they call a family social history. So that's where we ask you about diseases like hypertension in the family, diabetes, and other things. Then we also take a psychiatric history. We also ask you about those diseases. So a full history is taken. Now, when the full history has been taken, then we can be able to tell you that this one has an element which is hereditary, or it is hereditary, and this one is not hereditary. There are those ones which are hereditary, and we really need to let you know.
Like which one of those 4?
They all have a hereditary aspect. They tend to run in families. But it is not like, it's hereditary. That is what I would say is that that is the nature. Then there is the nurture. So they are usually, depending on what environment you're exposed to,
your
lifestyle, some of those things. So if you have a family social history of let us say schizophrenia, and then you become a drug abuser, then it's going to become, the
chances are okay.
Yes. Even things like addiction, there are also sometimes you find that there is a trait which runs in the family. Many times in church we say there's also a spiritual aspect to it.
Yeah.
But these are things which all of them, I think our parents, in my language, they say that he who wants to marry must first ask. And these are things they would ask. They will ask, okay, that family, where are you going? Are there mad people? Are there people who die early? Are there, those, they used to ask those questions, but they are
how
pertinent.
about that thing of dying early? Is it a thing?
No, in the medical world, I think there are conditions which will predispose you to a premature death,
Yeah.
which will not allow you to live to a certain age. Yes, it's there. So, but if, for example, in a family you find out that maybe, I'll give you an example. There are families where you find that at 25 someone has hypertension. They are getting a stroke at 35. And it's in the family,
Yeah.
you know. So such a thing you need to know. You get,
Yes.
there are things like that. There are cancers that run in the family. For example, those people who have I think Dr. Paul talked about breast cancer,
Yes.
the BRCA gene. So there are people who have that gene, and you need to know. You'll find that people who have that gene, the mother, a daughter, an auntie have all suffered from breast cancer. Maybe some of them have passed on, maybe some of them are still alive and battling it. So those are some of the things which we ask for when you do the comprehensive history. And if you're particularly worried about something, ask your partner. Say, let's find out about this in good spirit.
Yeah.
Yeah. Because I think you'll be happier in...
Target when the person is happy. When they are happy, they just got paid, everything is good. That is the time you bring it up. If you bring it in intense moments, then it is not good. But as we wrap up, any last words in regards to the pre-marital tests? This was one of the things I've always posted on the statuses. We are having this, but this one is the one that attracted most people. So people, I think people out there want to know. But like you said, there's the stigma, and then there's the fear, but also I think there's the lack of knowledge. Sometimes we fear also the tests. On average, how much does this thing cost to check at least those most vital tests that everyone needs before they say I do?
Between 60 and 100,000.
Okay.
Yeah.
So at most we can say you won't go beyond 150.
Yeah, you won't go beyond 150, and that's when we are now. By the time we reach 150, we are trying to zero in on a particular diagnosis or to rule out a particular thing.
Yeah.
But most times they will not go. The infectious ones, I can assure you, will not go beyond 40,000.
Okay.
Then now it's when we start grouping is around 10,000. It's around 50,000. Then the others now when we are starting to sickling might be the one which is a little bit expensive, which is about 50,000. But if there's a familial history, that 50,000 might save you 100 million.
That's so true.
Yeah. So
okay.
Let people not fear. Come to us. Prevention is better than cure.
Absolutely. Addy Memorial, where are you located? Where
we are found on plot 1516 Bahai Road. There are two ways you can access us. If you come from Gayaza Road, branch off at Gaz Kanyanya onto Bahai Road. We are about 300 meters from the road on your left-hand side. If you come from the upper side, where this being Chevando or coming from Chisasi, continue past Kampala Quality Kindergarten, and we are about 150 meters on your right-hand side. So we have a signpost there. We are very visible. Come and we'll do all these tests for you. Okay.
And what are the other services that you give at Addy Memorial? Everything?
We are a specialized hospital, so that means that we offer super specialized services in all areas of medicine, children's medicine, women's medicine, surgical medicine, especially orthopedic, that is bones, eyes. We do a lot of eye operations. We have a dialysis center, so for the people who have chronic kidney disease and they need dialysis, or who have had any issues and need dialysis, we have an intensive care unit. We have a maternity and a neonatal intensive care unit, so that means we can take care of young, small babies who are sick. So we do the full range of diagnostic and interventions at the Memorial.
Okay. All right. I plan to visit them, so I'll be letting you know when I get to. The other day I was passing by. I'm like, where is it? But one day I'll get to surprise our lovely doctors of Addy Memorial. Now, because I won't be seeing you until Saturday, Happy Valentine's Day to you and yours. We have the Valentine's Day marriage dinner will be, Agape Love marriage dinner will be happening this Saturday on the 14th of February 2026 right here at Victory Christian Center. We also have something for the singles. The meetup for the unmarrieds will be happening on the 21st of Feb 2026. And of course, we shall crown this entire love month with the mass wedding happening on the 28th of Feb 2026. We call upon you to be a part of all these things because we've catered for you all with wherever you are with love, married, single, or intending to make your intentions holy and walk in the right path with God by saying your I do's, and that will be at the mass wedding. Until tomorrow, have yourselves a blessed day. Do not forget we have the lunch hour fellowship from 1 to 2:15 p.m. and the overnight prayer service that will be on Friday from 6 p.m. to 6 a.m. Bye-bye.